Welcome back to Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I'm so pleased you could be with me for this third segment today when I discuss fat elimination and body contouring. One of the most common requests I see in my practice as a plastic surgeon is the request or the desire to eliminate fat, whether it be by liposuction, tummy tuck, or a new method called cryolipolysis or CoolSculpting. That's one of the most common requests that I see in the office. What I'd like to do is take a few minutes to discuss the options and the choices and the alternatives that we have available to us to eliminate fat and to do body contouring. In general, there are three approaches to body contouring. I used to tell my patients that there are two approaches, but now we have a third approach, CoolSculpting, and I'll talk about that towards the end of the segment. So first of all, what do I mean by the open approach to body contouring? The open approach is when we make incisions and we remove big blocks of skin and fat, essentially like a tummy tuck. A tummy tuck is an open approach to body contouring. Another approach would be an arm lift. Another approach is a thigh lift or a buttock lift, etc. That's when we make an incision. We can remove a big block of skin and fat. We can tighten up muscles on the inside if need be. And we can give a markedly improved contour of, say, the abdomen. We can firm up the abdominal tissues. When I talk about tightening up the muscles on the inside if need be, oftentimes, for example, after pregnancy, the muscles will become stretched out and the fascia will become stretched out as well. The fascia is the covering of the muscle. Now, after delivery, it's possible for the muscles to be strengthened and they'll become short and toned again. However, for most women, when the fascia becomes stretched out, it never returns to its original length and resilience. So sometimes, even if a woman does 1,000 sit-ups, she'll still have a laxity of the abdominal wall where the fascia is stretched out. Now, for those of you who eat steak, you'll know what gristle is. That's the end of the steak. It's very tough. It's like leathery. That's fascia. And throughout our body, the muscles are covered with fascia. That's a connective tissue made of collagen. And so typically, when the fascia is stretched out, it never returns to its original strength and resilience. So when we do a tummy tuck, say, for example, on a woman who's had a few children, oftentimes, in addition to removing blocks of skin and fat, we'll tighten up the fascia and muscles on the inside. So tummy tuck is a good operation for someone with extra skin, lots of stretch marks, and who has a lax abdominal wall from being stretched out. So the advantage, of course, and please keep in mind in plastic surgery, as in life, there are advantages and disadvantages to every decision. There are pros and cons to each decision. The advantages to an open approach to body contouring is that we can remove big blocks of skin and fat. We can tighten up muscles on the inside if need be. However, the downside is it's a bigger operation. Oftentimes people will require drains afterward. They require an anesthetic. And of course, there is a long, permanent, visible scar, depending upon the amount of skin we need to resect. Even plastic surgeons, when we make an incision, there will be a long, permanent, visible scar. Scars are unpredictable. I have patients where I make incisions in their tummy, in their belly to do a tummy tuck, and a year later it's very difficult to find the scar. I also have patients, same surgeon, my patients, who have quite heavy scars. Scars are pretty unpredictable. Certainly there are some maneuvers that we can do in the operating room to minimize a scar, and we can maximize a person's chance of having a not so pronounced scar. Of course, we're plastic surgeons, but I like to tell my patients that scars are unpredictable, and any time we make an incision, there will be a scar. We try to hide scars. For example, when I do a lateral brow lift, oftentimes I can put the incision in the hair-bearing skin. When I do liposuction of the face, which I'll talk about later, I make very small incisions where the earlobe meets the cheek and the little crease under the chin, and that way I can do liposuction of the neck area. And those scars are very hard to find. So we try to hide scars, we try to disguise scars. Of course, we use plastic surgery technique. But in a tummy tuck, for example, or an arm lift, when I use the open approach, there are invariably scars. There are scars that remain. So the open approach, again, in summary, is where we make incisions, we can remove big blocks of skin and fat, tighten up the muscles if need be. Of course, that's a more of an invasive operation than, say, liposuction, which I'll get to. But again, there are advantages and disadvantages to that open approach. So let's go to tier 2, or another option. The closed approach to body contouring essentially is liposuction. What liposuction is, we make very small incisions. I put in a tube, it's called a cannula, and I attach the cannula to suction, and I can mold and shape and tailor with that tube, with that cannula, through the fatty layer, and I can vacuum out fat cells. Now, the advantage is the scars are very small, we can hide them, and we can remove lots of fat cells. The disadvantage is I can't remove extra skin, and I can't tighten up muscles on the inside if need be. So, excuse me, some people come in and they want abdominal recontouring, body contouring, and I will recommend the closed approach only. That's liposuction. That's essentially for people who don't have lots of extra skin, who don't need the muscles or fascia tightened, and they have enough fat cells that it's worth the risk to remove by liposuction. So that's the person who's a good candidate for liposuction, is the person who does not have a lot of loose skin, or who doesn't need muscles tightened up. It really works. The fat cells do not come back. What's important to remember is after adolescence, the absolute number of fat cells we have in our body is relatively constant. When we gain weight, the fat cells that we have get bigger. When we lose weight, the fat cells that we have get smaller. It's not true that if we gain weight, we grow new fat cells. Now, keep in mind that there are certain tissue types in the body where we do actually grow new cells. The skin can grow new cells. The muscles can grow new sarcomeres and essentially grow new cells. Bone can actually add new bone cells and get larger. But fat cells, we don't add new cells when we gain weight. It's just that the existing fat cells get bigger. If we lose weight, they get smaller. So liposuction actually works. Now, let's say if someone has liposuction and they don't exercise, they eat too much, they don't watch what they eat, etc., and they gain weight. Other fat cells within the body will of course get bigger, but those fat cells that are removed, they don't come back. And the belly, or the abdominal area, the belly doesn't grow new fat cells. So again, liposuction is a way for us to vacuum out fat cells, and we can mold and shape and tailor while we do that. And it really works. Small areas can be done in the office under a local or a block. I like to use something called Hunsted's formula. After I numb up the skin with a lidocaine, most people are familiar with lidocaine when they go to the dentist. I use something long-acting called Marcaine. And when the skin is numb, then I can use something called Hunsted's formula, which is a solution that numbs up the fatty layer. Very dilute numbing. And so small areas can be done right in the office while people are awake. I can suction out fat cells. So again, the open approach is things like tummy tucks where we make incisions, removing big blocks of skin and fat, tighten up muscles if we need to. The closed approach is liposuction. Very small incisions, suctioning out fat, molding and shaping and tailoring. But again, we don't remove skin, we can't tighten up the muscles. Some people come in and I recommend liposuction. Some people come in and I recommend a tummy tuck, only the open approach. Some people I recommend to them that we do a combination of a closed and open approach. For example, sometimes for the flanks, that's the lower part of the back near the love handles, and for the waist, those areas can be very appropriately treated with liposuction. Just by molding, shaping, and tailoring, we can give someone less prominent love handles and a more narrow waist. And I'll recommend a tummy tuck, say for the anterior abdomen where there's lots of loose skin and perhaps loose muscle or loose fascia. So a person like that might get a combined approach, closed, liposuction, and open approach with a tummy tuck. Now, before I move on to the third category, I want to make sure you understand that the tummy tuck incision or abdominoplasty incision can vary according to length and according to the amount of skin that needs to be removed. There's something called a mini tummy tuck where I make a fairly short incision for someone who just needs a little bit of skin removed in the central lower abdomen. and oftentimes through that incision I can tighten up the muscles and fascia with a fiber optic instrument, with a fiber optic retractor, for example. On the other hand, if someone has lots of loose skin, say hip to hip, after pregnancy or after losing massive amounts of weight. I see lots of people who come in the office now who have been on aggressive diets or who have gotten a gastric bypass or gastric banding, who lose over 100 pounds and they have loose skin. And so that's the kind of person who will probably get a longer incision. So again, all these operations and procedures that we offer can be custom designed. I like to custom design an approach for each patient. It's not a cookie cutter approach or one size fits all operation. Now, I said at the beginning of this segment that we now have a third option. And the third option is to eliminate fat cells with temperature extremes. Let me mention briefly that we've known for a long time that heat or inserting a laser probe can essentially melt fat cells. Now, yes, that can be used. My concern with that type of approach is that the protein, collagen, etc., are oftentimes denatured with excessive heat, and so the tissues can become brittle. They can lose resilience, and so I think that has to be done very carefully. For example, laser lipolysis. I think that has to be done very carefully when we use heat to melt fat cells because of the potential effects on other tissue. Now, what we do offer now in my office and through other offices is something called cryolipolysis. Essentially, cryolipolysis is using the other temperature extreme to eliminate fat cells. Now, let's back up for a moment and I'll try to explain this. Harvard researchers noted a number of years ago that children who actually would suck on popsicles a lot, the frozen juice treats, popsicles, actually would develop some fat atrophy in their cheeks. In certain parts of the world, Northern Europe, for example, where women in certain types of dress were riding horses for long periods of time in certain clothing where their outer hips or those areas in the outer thighs, the so-called saddlebags, were exposed to the cold, they started to lose fat. So these Harvard researchers went to the laboratory, and in fact, fat cells will be eliminated by lowering the temperature of the tissue, and at a certain temperature, the fat cells will then be eliminated over the next few weeks to a few months, but the other soft tissues will survive. So that brings us to the idea of cryolipolysis or CoolSculpting. A CoolSculpting machine is a device that's done in the office with no anesthesia while a patient is awake. If you picture sort of a vacuum cleaner with a suction device, the person is awake. It doesn't require an anesthetic. No incision is required. That vacuum is applied to a person's soft tissue. For example, a love handle, parts of the waist, the abdomen. It comes in different sizes called applicators. That soft tissue is suctioned in between two plates. Over the course of the next hour, the temperature is lowered by the computer to about 50-55 degrees. And then following that, over the course of the next few weeks to a couple of months, about 19 to 25% of the fatty layer will be eliminated. The body just sort of digests it and it's eliminated. No incisions, no anesthesia, very little downtime. So again, that's called cryolipolysis, commonly called CoolSculpting. So again, it's done in the office without anesthetic, without an anesthesia, where the soft tissue is suctioned in between two plates. The temperature is lowered to about 50 or 55 degrees, and over the course of the next few weeks to months, couple of months, about 19 to 25% of the fatty layer will be eliminated. It can be repeated on an area. It takes about an hour for one application. So a person can come in and have 2 or 3 or 4 hours of treatment in a day. That's 2 or 3 or 4 different areas treated in a day. And as I said, it can be, or the fat is eliminated by the body in the next few weeks to a few months, and it can be repeated. It works. It's not for a person with a lot of loose skin because of course it's like liposuction. It doesn't remove any skin. We can't do that. So I think it's a very valuable tool in fat elimination. It's one of the newer treatments that we have available to us. In addition to the open approach, which is tummy tucks, the closed approach, which is liposuction, we now can offer CoolSculpting or cryolipolysis. If you have any questions about any of these methods of body contouring or another question about plastic surgery, you can call my office. I'm Dr. David Morwood. I'm a board-certified plastic surgeon here in Monterey, 831-646-8661, or my website is drmorwood.com. That's D-R-M-O-R-W-O-O-D. Perhaps you have an idea for a guest or you'd like us to address a certain topic here on Your Health. We'd be delighted to hear from you. Thanks very much to Jim Bozen and to Mary Lou. Once again, this is Your Health television program. I'm Dr. David Morwood, a board-certified plastic surgeon here in Monterey. Thanks very much for joining us.